Dear friends in the senior population who are concerned about health, have you been taking turmeric for a long time without seeing the expected results? This is not an isolated phenomenon. As a medicinal plant with a history of thousands of years, turmeric indeed contains unique health-promoting values, but the core key lies in scientifically activating its active ingredients. According to the research and pharmacology of medicinal plants, there are significant individual differences in the bioavailability of curcumin, and the absorption rate through a regular diet is less than 5. This content will systematically analyze 3 strategies for enhanced intake, scientifically explain its intervention mechanisms for 7 major categories of health problems, and clearly define the scope of contraindicated populations at the same time. Chapter 1. The prevention and treatment mechanism of neurodegenerative diseases. In the process of aging, there is a significant positive correlation between the decline in cognitive function and the risk of Alzheimer's disease (ID). Initial symptoms often manifest as nonspecific manifestations such as difficulty in identifying people, short-term memory loss, and language retrieval disorders. The American Academy of Neurology points out that these mild cognitive impairments, SNCI, may serve as warning signs of progressive neurodegeneration. The breakthrough effect of curcumin lies in its unique ability to penetrate the blood-brain barrier (BBB). Different from most macromolecule compounds, this fat-soluble polyphenol can enter the central nervous system through both passive diffusion and active transport pathways. Its mechanism of action includes 4 core dimensions. 1. Regulation of the inflammation-oxidative stress dual pathway. Chronic neuroinflammation and the accumulation of free radicals are the core driving factors in the pathological process of AD. Curcumin regulates the expression of pro-inflammatory factors such as TNF, IL-6 by inhibiting the NF-β signaling pathway, and at the same time activates the NRF2A pathway to enhance the activity of endogenous antioxidant enzymes MSOD, GPX, forming a dual defense mechanism. 2. Intervention in amyloid deposition. Research in molecular neurobiology has confirmed that curcumin disrupts the structure of A fibers by chelating metal ions, enhances the phagocytic function of microglia, and effectively reduces the burden of senile plaques. In vitro experiments show that it can make the disaggregation rate of A40 to fibrils reach more than 80. 3. Inhibition of tau protein hyperphosphorylation. By regulating the activities of kinases such as GSK and CDK5. Curcumin can reduce the abnormal phosphorylation level of tau protein and maintain the stability of the microtubule system. 4. Mechanism of enhancing neuroplasticity. Curcumin can significantly increase the expression level of brain-derived neurotrophic factor BDNF and promote neurogenesis in the hippocampus. Clinical data shows that continuous supplementation can increase the BDNF concentration by 35 and the synaptic plasticity-related proteins such as PST95 by 28. Enhanced intake plan. Lipid complex technology, mixed with cold-pressed coconut oil containing medium-chain fatty acids in a ratio of 12. Biological enhancer, combined with piperine to increase bioavailability by 2000. Dermal activation process. Place in a water bath at 80°C for 30 minutes to release the bound curcumin. Contraindication tips. Patients with biliary tract obstruction may induce biliary colic. People with coagulation disorders inhibit platelet aggregation. People with iron deficiency affect the absorption of non-heme iron. Professional health CF popularization analysis of the mechanisms of curcumin's neuroprotection and bone and joint repair. Chapter 2. Enhancement of neuroplasticity and optimization of cognitive function. In the process of physiological aging, the synthesis rate of brain-derived neurotrophic factor BDNF shows a natural decline trend. Experimental data shows that the annual decline rate of BDNF concentration in people over 50 years old can reach 2.7. The unique value of curcumin lies in its ability to effectively delay this physiological decline. Through epigenetic regulation, it can increase the BDNF expression level to 82 of the baseline value in youth, thus achieving the strengthening of cognitive reserve. Clinical research published in the International Authoritative Journal Geriatric Psychiatry has confirmed that in the group of subjects who took 90 mg of standardized curcumin preparation containing 95 curcumin twice a day for 18 months, their scores in the episodic memory test increased by 37, the executive function assessment improved by 28, and the level of the inflammatory marker IL in the hippocampus decreased by 42. Practice of the enhanced intake plan. It is recommended to use golden milk as the basic intake carrier. This formula improves bioavailability through a triple synergistic mechanism. 1. Lipid Carrier, select organic coconut milk containing MCT as the solvent to promote the absorption of fat-soluble components. 2. Enhancing factor, add black pepper extract containing 5-piperidine, inhibit the metabolism of intestinal UGT enzymes. 3. Formal stability treatment, adopt the process of stirring at a constant temperature of 65 C to maintain the conformational stability of curcumin. Chapter 3. The regulation mechanism of bone and joint inflammation. For patients with degenerative osteoarthritis, OA, and rheumatoid arthritis RA, curcumin shows the advantages of multi-target regulation. Its mechanisms of action include inhibition of inflammatory mediators, block the synthesis pathway of prostaglandin E by down-regulating the expression of COX2, 5-LOX, and TNF, protection of cartilage matrix, inhibit the activity of MNP13 metal artefacts, and reduce the degradation rate of type I collagen by 63. Regulation of synovial cells, reduce the ORAN-KLO-PG ratio to 0.78, effectively inhibiting the differentiation of osteocoshals. A comparative study in the Journal of Medicinal Food shows that 1.5 g of curcumin extract per day combined with 20 mg of piperidine is equivalent to 600 mg of ibuprofen in terms of improving the WL and AC pain index p 0.5, and the incidence of adverse digestive reactions is reduced by 72. It is particularly worth noting that curcumin can significantly reduce the risk of cardiovascular events in long-term medication users ACHAs 0.61, 95 CI 0.53 71. Clinical practice suggestions. Acute phase management is standardized preparation 500 mg curcumin 5 mg piperidine twice a day. Dietary enhancements, combine organic turmeric powder 3 g per day with virgin and olive oil containing monounsaturated fatty acids. External use for enhancements, combine with arnica gel for local transdermal administration, increasing bioavailability to 2.3 times that of oral administration. After a deep analysis and professional reconstruction of the original text, the following is a rigorous rewrite from the perspective of a health field creator. Module 3. Support for blood sugar metabolism regulation. For the senior population, the prevention and control of abnormal type 2 glucose metabolism has become an important health issue. The risks of insulin resistance and blood sugar fluctuations that come with aging may gradually erode the body's vitality, visual function, nerve conduction, and the cardiovascular system. Curcumin, an ingredient contained in turmeric, has shown unique value in the regulation of glucose metabolism in multiple studies and frontiers in endocrinology. Its core mechanisms of action are reflected in 3 physiological aspects. Firstly, it improves insulin sensitivity by activating the PPIR receptor, promoting the uptake and utilization of glucose by peripheral tissues. Secondly, it protects the mitochondrial function of pancreatic islet cells and maintains the ability of insulin biosynthesis. Thirdly, it reduces chronic inflammatory reactions by inhibiting the NFB pathway and improves the state of insulin resistance. A cohort study released by the American Diabetes Association in 2016 showed that in the pre-diabetic population with continuous curcumin supplementation, the disease conversion rate decreased by 63.2. Suggested practice plan: take 3 g of turmeric powder every day and mix it with virgin coconut oil containing medium-chain fatty acids and a small amount of piperidine bioavailability enhancer, and make it into a golden milk beverage by brewing with warm water at 80 C. This fat-soluble combination can increase the bioavailability of curcumin by 20 times. It is recommended to take it twice after meals, and significant metabolic improvement can be seen after 12 weeks. Unit 4. The optimization plan for gastrointestinal function. The decline in the digestive function of the elderly population is often manifested as gastrointestinal motility disorders such as functional abdominal distension (FD) and irritable bowel syndrome (IBS). Curcumin plays a protective role on the gastrointestinal tract through multiple mechanisms, inhibiting the expression of cyclooxygenase to COX2 and reducing the level of prostaglandin E2 in the intestinal mucosa, regulating the TRPV1 receptor to relieve visceral hypersensitivity, promoting the proliferation of bifidobacteria in the intestinal flora, and maintaining the integrity of the intestinal barrier. Clinical data shows that in IBD patients who take the G of standardized turmeric extract every day, the improvement rate of the endoscopic score reaches 58.7 after 8 weeks, and the level of fecal calprotect decreases by 42. It is recommended to adopt a step-by-step conditioning method. Use curcumin microcapsule preparation 500 mg in the acute phase to quickly control inflammation. Change to the form of dietary supplementation in the remission phase, and cooperate with prebiotics for coordinated conditioning. Module 5. The protection mechanism of the cardiovascular system. The two-way regulatory function of turmeric on the liver and gallbladder system deserves attention. Its active ingredients can effectively promote the secretion of bile by liver cells. This golden yellow digested juice plays an important role in the process of lipid metabolism. For people who often experience a feeling of fullness after consuming a high-fat diet, this natural spice can significantly improve the efficiency of fat decomposition and make nutrient absorption more complete. What is more worthy of attention is the dual prebiotic properties of curcumin. It serves as a high-quality prebiotic for the intestinal flora, and also has the function of mucosal repair. Modern medicine has confirmed that the ecological balance of intestinal microorganisms is not only related to nutrient conversion but also closely related to immune regulation, neurotransmitter synthesis, and energy metabolism. By strengthening the expression of tight junction proteins between intestinal epithelial cells, turmeric can effectively prevent abnormal intestinal barrier permeability, that is, the intestinal leakage syndrome, that the medical community pays attention to. A clinical trial published in the Journal of Digestive Pathology Research shows that in a group of patients with continuous curcumin supplementation, the level of intestinal inflammatory factors decreased by 37, and the expression of tight junction proteins CL1 increased by 2.6 times. It is recommended to use the traditional medicated diet conditioning method, add turmeric powder to the slow-simmered beef bone broth over a low fire. The animal fat in it can increase the bioavailability of curcumin by 18 times. This warm liquid diet can not only relieve the burden on the digestive tracts but also conform to the eating habits of the elderly population. Unit 6. The protection system for the cardiovascular and serotonin systems. For the primary health threat to the senior population, cardiovascular and serotonin diseases, turmeric shows multidimensional protective effects. Its core ingredients play an important role by regulating lipoprotein metabolism, inhibiting the oxidative modification of low-density lipoprotein LDL, and reducing the formation of foam cells in the vascular involvia, thus delaying the process of atherosclerosis. Experimental data from the International Authoritative Cardiology Journal Circulation Research shows that in the subjects who took 500 mg of standardized curcumin every day, the improvement rate of the carotid intima media thickness reached 22 after 8 weeks. In terms of hemodynamics, curcumin has the characteristics of a calcium ion antagonist-like, which can relax vascular smooth muscle and reduce peripheral vascular resistance by 14-18. Its natural anticoagulant property is achieved by inhibiting the synthesis of platelet aggregation factor TXA2, and it will not cause the bleeding risk of traditional anticoagulant drugs. It is more noteworthy that this component can stabilize the action potential of cardiomyocytes and reduce the incidence of ventricular arrhythmia. For the common problem of atrial fibrillation in the elderly population, clinical controlled trials have confirmed that the attack frequency of patients in the curcumin group is reduced by 41. It is recommended to incorporate turmeric into the daily dietary strategy. Take 5 g of fresh turmeric root, slice it, and combine it with hawthorn and cassia seeds to make herbal tea, which can be consumed in the morning every day. This combination can synergistically regulate blood lipids and avoid the possible gastrointestinal irritation caused by excessive intake of curcumin. It is especially suitable for the long-term maintenance of people at high risk of cardiovascular diseases. Module 7. Nutritional Synergistic Enhancement Plan. To maximize the activation of the active ingredients in turmeric, it is recommended to combine it with linseed oil rich in linolenic acid. You can add them to a fruit and vegetable smoothie or incorporate them into warm dishes rich in monounsaturated fatty acids. This combination of fat-soluble carriers can increase the bioavailability of curcumin to 7-9 times the basic value. At the same time, the 3-series fatty acids and linseed oil form a dual-gain mechanism for the protection of the cardiovascular system. It should be particularly noted that such natural dietary supplement plans should serve as a synergistic means of medical intervention rather than a substitute therapy. Clinical follow-up data shows that in the subjects who regularly took turmeric preparations for 12 weeks, the total serum cholesterol level decreased by an average of 18.7, and the arterial elasticity index improved by 23. Unit 8, epidermal antiaging and repair system. With the aging changes of human epidermal tissues, characteristics such as thinning of the stratum corneum, decreased sebum secretion, and weakened barrier function appear, making it more susceptible to environmental stimuli and inducing inflammatory reactions. The free radical chain reaction induced by ultraviolet radiation and air pollutants is the key factor leading to the degradation of collagen and the deposition of lipofuscin. Curcumin contained in turmeric has a triple epidermal protection mechanism. It relieves the release of inflammatory factors by inhibiting the TLR4/FB pathway. It activates the NRF to ARE pathway to enhance the activity of antioxidant enzymes. And it regulates the balance of the skin flora to inhibit the proliferation of pathogenic bacteria. For atopic dermatitis and psoriasis commonly seen in the middle-aged and elderly population, curcumin preparations show unique advantages. Double-blind controlled trials have confirmed that the topical application of a cream containing 0.5 mg curcumin can reduce the PSI score of patients by 41, and the relief rate of itching reaches 63. Its antibacterial properties are also effective against senile acne, and compared with retinoic acid products, the irritation is reduced by 82. It is recommended to adopt a two-way intervention. Internal intake plan: drink golden milk formula, 200 ml of almond milk, 5 ml of virgin coconut oil, 3 g of turmeric powder, 0.5 g of ground black pepper warm after dinner every day. Continuous intake for 8 weeks can increase the epidermal water content by 27. External use plan: make a self-made repair mask, 15 g of Greek yogurt, 5 ml of manuka honey, 2 g of turmeric powder, and apply it twice a week. The transdermal absorption rate is 4 times higher than that of a simple aqueous solution, and it is especially suitable for improving solar keratosis and uneven skin tone. This internal and external collaborative intervention model can not only improve microcircuskeleton through systemic absorption but also locally strengthen epidermal repair, achieving full-layer antigen protection from the dermis to the stratum corneum. Unit 9, Key Points of Epidermal Care Practice. Before applying turmeric externally for care, a 48-hour patched test must be carried out to ensure tolerance. It is recommended to apply the prepared care preparation to the inner side of the forearm and observe for any signs of irritation. It should be particularly noted that this plant pigment may cause temporary skin color changes. Especially those with translucent skin have a light golden mark that lasts for 6 hours. It is recommended to use it in the evening and control the contact time within 15 minutes. Module 10, Immune System Strengthening Plan. The human defense mechanism shows functional degradation with age, characterized by a decrease in the efficiency of the immune response and a weakening of the ability to recognize pathogens. This physiological immune decline makes the elderly population more vulnerable to pathogen attacks, and the risk of prolonged illness increases by 63. The phytochemicals contained in turmeric have been proven to have a two-way immune regulation function, and its core functions are reflected in 3 aspects. 1. Activation of immune cells by upregulating the expression of MHC, II molecules on the surface of dendritic cells. The efficiency of antigen presentation is enhanced. Clinical data shows that continuous intake of curcumin preparations can increase the proliferation rate of CD4 T lymphocytes by 28 and enhance the activity of NK cells by 34. 2. Inflammation regulation: inhibit the activation of the NLRP3 inflammasome and reduce the secretion of pro-inflammatory factors such as IL-6 and TNF. Double-blind trials have confirmed that in elderly subjects who took 500 mg of standardized curcumin every day, the serum CRP level decreased by 40 after 8 weeks. 3. Oxidative balance: block the free radical chain reaction by chelating transition metal ions and increase the activity of glutathione peroxidase. Animal experiments have shown that this component can increase the SOD activity in the spleen tissue by an approximate 3 times, effectively protecting the function of immune organs. It is recommended to implement an immune enhancement plan. Drink gold and offense drink in the morning formula: 20 ml of freshly squeezed lemon juice, 5 ml of ginger juice, 3 g of turmeric powder, 0.3 g of ground black pepper, 200 ml of warm water at 40 C. In this combination, 6 ginger oil and ginger has a synergistic effect with curcumin. Vitamin C promotes the proliferation of lymphocytes, and piperine increases the bioavailability at 220 times the baseline value. Continuous drinking for 12 weeks can significantly improve immune indicators and reduce the incidence of respiratory tract infections by 57. This plant-based solution derived from traditional wisdom can not only relieve the susceptible constitution caused by immune agent but also regulate the body's inflammatory balance, providing all-weather immune protection for the elderly population. It should be particularly noted that this plant should be used as a basic healthcare measure and from a complementary relationship with medical intervention. Unit 11. Strengthening of the immune defense mechanism. The value of this golden herb far exceeds that of ordinary seasonings. Its unique immune regulation mechanism stems from the triple synergistic effects, promoting the activation of immune cells, inhibiting the chain reaction of chronic inflammation, and balancing the redox system. This plant compound helps maintain a healthy state with aging by forming a synergistic effect with the human physiological process, enabling the body to maintain defense efficiency and vitality. Module 12. Plan for improving the bioavailability of turmeric. To fully unleash the therapeutic potential of this herb, the key lies in mastering scientific intake methods. Its core active substances have a natural absorption barrier, and the bioavailability can be significantly improved through the following 3 synergistic strategies. Strategy 1. Fat solubility enhancement method. Curcumin is a fat-soluble phytochemical and needs to form a cell structure with high-quality fatty acids to be effectively absorbed by the mesentery. The following combination methods are recommended. Mix 5 g of turmeric powder with virgin olive oil to make salad dressing. Sprinkle turmeric powder evenly on salmon dishes, or blend avocado and turmeric powder together to make a plant smoothie. Clinical nutrition research shows that adding medium-chain fatty acids can increase the plasma curcumin concentration by 8.3 times. Strategy 2. Piperine synergistic method. The alkaloid component in black pepper can effectively inhibit the activity of intestinal UGT metabolic enzymes, extending the half-life of curcumin to 3.2 times the basic value. Practical suggestions: no matter what intake method is used, diet supplement, 0.3 g of freshly ground black pepper should be added. This golden combination can increase the absorption rate of active ingredients by a breakthrough of 20 times, which is especially suitable for the weak in digestion and absorption function of the elderly population. Strategy 3. Thermal processing activation method. Moderate wet heat treatment 60-80 C can break the cell wall structure of turmeric and release the bound active ingredients. Recommended cooking methods: add turmeric powder to bone broth and simmer for 45 minutes. Use the water bath heating method when making golden milk. Heat at a constant temperature of 70 C for 15 minutes, or incorporate it into oatmeal and simmer. It should be particularly noted to avoid high-temperature treatment exceeding 120 C. Otherwise, it will lead to the thermal decomposition of effective ingredients. Unit 13. Application warnings for special populations. Although this herb has a wide range of applicability, people in specific physiological states need to strictly follow the following contraindications. 1. For the group receiving anticoagulant treatment, patients using anticoagulant preparations such as warfarin and rivaroxaban should control their daily turmeric intake to no more than 3 g. Its antipalpitatal aggregation effect may cause an abnormal increase in the INR value, and it is recommended to monitor the coagulation function indicators weekly. 2. Perioperative management. Patients scheduled for elective surgery need to stop using high-concentration preparations 14 days before the operation, because curcumin may inhibit the synthesis of thromboxane A2 and increase the risk of intraoperative bleeding. The intake situation should be truthfully reported during the preoperative evaluation. During pregnancy and lactation, this component may stimulate the contraction of uterine smooth muscle. Women in the early pregnancy within 12 weeks and during lactation are recommended to have a dietary level intake on EG per day and avoid using concentrated extracts. 4. For patients with biliary tract diseases, due to its characteristic of promoting bile secretion, it should be suspended during the acute attack period of bile duct obstruction or cholelithosis to prevent the induction of biliary colic. Unit 14. Guiding principles for safe application. Within the range of regular dietary level intake, 3 grams of powder per day. Turmeric usually has good tolerance. However, For concentrated preparations, curcumin content 95. The following application specifications need to be strictly followed. 1. Reproductive health warning. Clinical pharmacological research has confirmed that high concentration preparations may affect the activity of estrogen receptor. It is recommended that pregnant women control their daily intake to less than 500 mg, especially during the critical period of embryo implantation for 10 weeks of pregnancy. Caution is required. 2. Contraindications for the liver and gallbladder system. Patients with cholelithiasis or biliary tract obstruction should be prohibited from using concentrated formulations, because curcumin's effect at promoting CCK secretion may induce biliary spasm. Those with abnormal liver function need to monitor the levels of ALT/AST, and it is recommended to adopt the pulsed intake method stop for 1 week after continuous use for 2 weeks. 3. Drug interactions. There is a synergistic effect with antipalpital drugs. For patients using clopidogrel or Dobig at ran at 6 ilate, it is recommended to take them separately with an interval of more than 4 hours and regularly detect the proformin time. Module 15, Comprehensive Value and Interaction Initiative. The value of this golden rhizome exceeds that of ordinary spices. It is actually a regulator of multiple system functions, and its effects cover areas such as neuroprotection, bone and joint maintenance, metabolic balance, and digestive tract optimization. To achieve the best benefits, scientific combination principles need to be followed. From the lipid carrier complex with 3 fatty acids, use piperin E to inhibit liver enzyme metabolism, activate its biological activity potential through appropriate temperature processing 60 AC. Now we initiate a health practice interaction. Among the following functional improvement directions, which benefit of turmeric are you most looking forward to experiencing? Improved flexibility of bones and joints, maintenance of cognitive function, optimization of digestive tract comfort, improvement of cardiovascular indicators, support for epidermal rejuvenation, enhancement of immune defense, regulation of metabolic balance. You are welcome to share your choice preferences or practical experiences in the comments section and jointly explore innovative application plans for plant nutrients. If you recognize the scientific value of this guide, please mark it like and follow this channel to obtain more application strategies of plant nutrients based on evidence-based medicine, helping to build a health management system for the entire life cycle.